It's hard to plan for family vacations or even a night out or a birthday party because you never know when it's going to happen. The symptoms began, I believe, shortly after she was born, where we had failure to thrive. There was a lot of vomiting, there was a lot of diarrhea, and a lot of crying, like nonstop crying, more than colic, and that gut feeling that a mom has where something's just not right. Probably about age 2, she started having these vomiting episodes about once a month. And this went on for months and months and months and months, and I kept taking her back to the doctor, and I spoke with my nephrologist, and he said, "You've got to do something," because also along with the vomiting comes a horrible headache, and then occasionally she goes unconscious, and she was just in terrible pain. We decided to bring her down here at the urging of my own nephrologist because things just weren't right. On September 22nd of 2014, they drew blood to send to a lab to have some genetic testing done on Laila. And on December 5th of 2014, we received confirmation that in fact Laila did have a variant of that gene that is associated with the hypokalemic periodic paralysis. To have a positive diagnosis was huge for Laila because it gave validity to her situation, and it gave validity to me because for 5 years I felt as though I was going crazy. Hypokalemic periodic paralysis is an ion channel disorder between the sodium and potassium relationship that they have inside the cells in your body. The way that I understand it is the potassium and the sodium inside Laila's body, in each individual cell, they don't get along very well together. And what happens is there's either too much of one or not enough of another. And so when the gate opens in the cell, it allows too much potassium out and too much sodium in, and then you have that imbalance that causes her episode. And then that's when she gets the headache and the vomiting and the severe weakness. It's a very rare situation. Hypokalemic periodic paralysis can be triggered by eating too many carbohydrates like pasta. Colds can trigger her, too much activity can trigger her. With hypokalemic periodic paralysis and Laila's episodes, you never know when the episode's going to show up. Some patients are able to stay home. Laila is not one of those patients. So she is admitted roughly once a month. Occasionally it's 2 or 3 times a month, just kind of depends on the situation. So if we're sitting eating dinner and Laila's episode starts, everything stops for everybody in our house. And everybody has their specific job on what they need to do. Somebody's getting the suitcase, somebody's getting Laila's shoes on her, getting her a bowl for the vomiting, somebody's carrying her to the car, and I'm making the phone call to Dr. Brophy, letting them know we're on our way. It affects her life. She can't run around as much as other children. We're concerned about letting her play sports and the commitment that that entails. She has a port in her chest now so that she can receive her potassium at a higher rate of speed and a higher dose. During these episodes, it's important that that potassium is replaced as quickly as possible, because when you have hypokalemic periodic paralysis and you're low on potassium, that affects your heart and your lung muscles. And these types of situations can be life-threatening if it's not reversed as soon as possible. None of the doctors that we have seen have had patients with this. They only read about it in medical books. Laila has taught me personally about toughness. When you have a 5 and a 6, 7-year-old child that has to go through weekly blood draws or have heart monitors hooked up to her, I really shouldn't complain about anything. She's 7 and she's never said, "Why me?" She just deals with it. The care she's received here has been phenomenal, so I would say thank you to them and for their care and for believing in what we were seeing with our child. It's made a huge improvement in her life and our life.